PMS is premenstrual syndrome. Now what are they? Basic symptoms we feel: mood fluctuations, having irritability, feeling anxious or just sad at some point, and physically might get headaches, body pains, swelling in arms and legs, and as well as breast tenderness. So these symptoms are very common, and a professional needs to guide you through it whether it classifies the criteria to become a disorder. So we all face some or other kind of premenstrual symptoms, but for it to become a syndrome and become a clinical diagnosis, it requires some kind of clinical evaluation, both hormonal as well as your physical symptoms and your moods also. So it's okay if you're menstruating to have little bit changes in the hormone, but if they are interfering with your social, personal, professional, work, college, any life, they need any kind of management. Now secondly, stepping up to bigger sister of PMS, that is the PMDD, the premenstrual dysphoric disorder. This has a larger criteria. Again, these symptoms are a little bit severe than PMS and they start in the week before menstruation. So there's n number of criteria: feeling irritable, sad or depressed, anxious, mood fluctuations, hopelessness, helplessness, sleep disturbances. You have food irritabilities or any kind of cravings about any specific food. So there might be decreased sleep or increased sleep also. And all these criteria, so 5 or 6 symptoms need to be covered during this time, and for at least two cycles in your menses for a duration in 1 year. So 2 cycles in duration of complete 1 year, then it could be classified as having a PMDD. So this is more severe than PMS, disrupts the personal, professional, social life on a much larger level, but still it is very, very underdiagnosed again, because PMS, a lot of people have accepted that maybe this is the life and we have to live life like this and might be no way out of it. But no, let me tell you some kind of evaluations or some kind of remedies that we can do there. First of all, these are just tips and remedies, not a clinical diagnosis until your doctor has seen your case completely and evaluated. So some dietary supplementations have been studied and research has shown that calcium supplementation might decrease some of these symptoms. So 1200 milligrams of calcium is a good dose to help you without these symptoms. Also, vitamin B, especially B6, helps with these symptoms and might help you some kind of mood fluctuations. Secondly, antidepressants and anti-anxiety meds, your psychiatrist can prescribe them. They work very good with PMS and PMDD symptoms. If you feel your life is being disruptive and you're not able to concentrate or focus and feel very irritable and moody at that time, you are not alone. There's so many people who feel like that, and you deserve to live your best life. Please get that evaluation done and get the right treatment at the right time. Usually a person first goes to the gynecologist with any such kind of complaints. So after evaluating, they could also provide you with an option for taking oral contraceptive pills, commonly known as OCPs, which somehow regulates the hormones which have been going haywire and gets relief from these symptoms. Also, they could refer you to a psychiatrist who could evaluate this in detail, and you could work with both antidepressants and therapy together. So it's completely upon your choice to be served upon these options, and you could take whichever you like and whichever suits you the best. Plus, cognitive behavior therapy works a lot like wonders in this case, because it's helped you evaluate what is happening with me, realizing my own thoughts and channelizing them also. So yes, there are so many things that could be done at this point of time, but first and foremost, the diagnosis is important. The more we spread awareness about these things, the more women and menstruators, they come up and talk about those things, and the acceptance in society increases. So yes, hormones affect mood to a lot big level. It is not just about menstruation. The overall fluctuation of these hormones throughout this cycle, it changes again and again, and hence lead to different kinds of mood at different times in this cycle. But that does not mean that they can hold you back from doing the best life that you could be living right now.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.